So, well, as in all the Republican budget bills this week, we really feel like they are missing so many opportunities for Minnesota to build a stronger future for everybody in the state. And that's the case with this bill as well. But I really just wanted to particularly highlight today some big misses in just fundamental jobs of government that are missed in this bill. The first one, and Sheldon, Representative Johnson will speak a little bit more detail about this, but they have next to no money. They have some study money dealing with cybersecurity in Minnesota. Very serious commitment that the governor put a substantial amount of resources toward. We've had General Nash and others speak about the importance of doing this. If you look at what's happened, for instance, in Target in our hometown, if you look at the 500,000 hits that come into the Minnesota computer systems every year, if you look what happened in South Carolina, where tens of thousands of South Carolinians had their data exposed because of a breach, this is something we should be doing, and Minnesotans get that. The Republicans, in their zeal to give tax cuts to their special interest friends, are unwilling to fund a very fundamental job of government, and I think it's a huge miss. I would also say that the issue around not funding the state hospital and the Anoka, the changes that are needed in those areas, are also a big miss that puts public safety at risk and challenges us to actually even keep our hospitals open and serve people with mental health issues. Another huge miss for Republicans, again, because they want to save all this money for their tax cuts. The 5% campaign, which has been a big talking point for a lot of Republicans, including Chair Dean for many years, including this year, they put out a completely fake solution that actually doesn't provide any increase to anyone. It's perhaps the most cynical thing I've ever seen at the Capitol in my 14 years here, and is just the wrong direction for the state. And they do nothing. They traveled around the state talking about access and affordability of child care over the last several months leading up to the session. And in this bill, they do nothing to address that really whatsoever at all as well. We will have some amendments dealing with many of these items today and be talking about them. But just kind of setting aside the politics on all of this and what's there and what's not and what our priorities should be, I think all Minnesotans would agree that dealing with things like cybersecurity, dealing like things with the safety of our mental and our state hospital in the Anoka County, the Anoka facility, and then making sure that Minnesotans have access to child care and these workers get some resources. They're just not even doing their jobs. And I hope Minnesotans are paying attention, because they don't elect us to come down here just to make political points, although it may seem like that to many of you sometimes. But this is an area where we actually should be doing our job, because it's what's right for Minnesota. Whoever.
I met a woman whose son works at the St. Peter's Security Hospital, and her son has had more than one head concussion as a result of the work that he's doing with the patients that are residing in that facility. It is well documented. It is well documented that staffing is an issue both in Anoka and in St. Peter. The governor has made a very strong proposal for funding to make sure that the residents, the patients, and the staff are safe in their work and care in those facilities, and the Republicans have put not one dime into that proposal. It is no wonder that Minnesotans are frustrated with a legislative body like this one, when issues are very, very clearly laid out for the people of Minnesota, and this Republican House will take zero action. Today we're going to take up the issue of defunding Planned Parenthood. We've not seen that happen in Minnesota before. The action that we will take up today will mean that women will lose access to contraceptive care, access to screening for breast cancer, access for treatment for sexually transmitted diseases. Other providers, other clinics have let us know that they do not have the capacity to care for the women who will lose their coverage if the Republicans are successful today. We are seeing over and over this Republican majority bringing forward issues that divide Minnesotans, that answer their political call to action, but do nothing for the work or for the people of Minnesota. We will see that again today. Thank you.
Well, those of us who work in health and human services know that life isn't fair. We're reminded of that always. But with a $900 million surplus, it doesn't need to be so cruel. And the bill that's being brought before us leaves all kinds of gaps in a safety net that is not only just frayed, but it has major holes ripped in it. And what the people were bringing to us in hearing after hearing were proposals for crisis-level fixes, and we don't have that. Increasingly, our system is being challenged in the courts. We have a court monitor who's supervising all of our disability services. We have the federal government overseeing all of our mental health services. And we have story after story of tragedy and desperation that has not been responded to in this bill. Whether it's the home care industry, where we have proven, we used to be known as a leader in using home care and community-based care to keep seniors at home, people with disabilities at home, and serving them with more dignity and with more independence and more cheaply than putting them in institutions. But that system is in crisis. There's 8,500 vacancies in that workforce right now because the pay is so low, you can't get people to work for $10 to $11 an hour, and we can't even get them a 5% increase. They got 0 last year. The system is falling apart. 7,000 families are on the waiting list for basically sliding care. I could go on and on about the waiting lists and the gaps. This bill doesn't step forward to help with any of those.
So Tina Liebling from Rochester. So a lot has really been said about our bill today, about the GOP bill, and I would echo all of that. I found it especially cynical last night when at the end of our long debate on the big omnibus bill we did yesterday that Majority Leader Pepin talked about her little analogy of finding a quarter on the ground and then spending it on candy. And I just think that Minnesotans care about their neighbors. That's something that really characterizes the people in our state. They know that there are a lot of serious issues that we need to tackle. They send us here to solve problems. This is not spending a quarter on candy. And I think it's really telling that Representative Pepin characterizes this as such, all of these serious issues. We do have a $900 million surplus, and this is about where are our priorities. The House DFL caucus has priorities of solving the problems in this state. In health and human services, we have heard today there are many problems. The GOP even recognizes some of these problems in the very bill that will be heard today. The problem is, as before, that they fund some of the issues in a completely cynical and unsustainable way, and that is by taking all of the funding that was allocated just last session to allow the Department of Human Services to continue working on our eligibility system for our public programs. They think they're just going after MNsure. The whole bill is constructed to send a message that they don't like MNsure. I don't think anyone needs to be told that Republicans don't like the Affordable Care Act. Congress has voted umpteen times to remove it, defund it, and all of that. That's happening here in Minnesota. But what they're also doing is really undermining our whole system that allows our folks who have need, or even those who want to go into the private system of health insurance, to do these eligibility determinations and get that working. I heard Matt Dean just a few moments ago, again, characterize MNsure as a website. Well, we know that's not true. We know that what we're building is a very large system that is on its way, continually being improved to help streamline these very complex processes. And we are making progress on that, but what they're trying to do is simply rip the thing out by its roots, simply in a cynical manner, as far as I can tell, for purely political purposes.
Hello, I'm Representative Sheldon Johnson, and Minnesota's personal information, Social Security numbers, and financial information is at a high degree of risk, and the Republicans are doing nothing about it. I met with the IBM security team this morning at their request, and I asked them, what do you think of the situation here in Minnesota in terms of our cybersecurity? Here's what they told me. They said, we're currently at high risk of expensive and catastrophic breach of our citizen data. And they're very concerned that nothing is being done in that regard. As you probably know, just this past December, we had a breach of our court system data where our court system, their web information was down for 10 days because of hacker attacks from Canada and Asia. In the state of California, as Representative Thissen noted, just recently they had an attack on their data, a breach of their data that affected 79% of their citizens, cost them millions and millions of dollars. In Minnesota, we have roughly 500,000 transactions a day through our state system, over 28 billion in annual transactions a year. All this is at risk, and what have the Republicans presented as a way to deal with this problem? They've offered up a $500,000 study, which quite frankly isn't even needed because Minute and the Department of Revenue, which are dealing with this issue, have already done the legwork, and they're ready to go ahead with the kind of systems necessary to protect our data. So I just want to leave you with the fact that the Republicans are doing nothing about taking care of the very sensitive data, Social Security information, financial information that is at risk to hackers and cyber threats throughout the state.
If I could just add one more thing, too. I heard a question before when I was in the room, when Matt Dean was up here, and the questions were about defunding Planned Parenthood, and isn't this really about abortion? And in committee, I believe it's Representative Loeffler presented the bill and said it was about, women's health and all the things you heard here today. But then all of the testifiers talked about abortion. So I think it's very, very clear that this is not about women's health. As I believe Representative Murphy mentioned, the federally qualified health centers told us, and I believe told the Republicans, that they do not have the capacity to take care of the women who would be unable to go to the Planned Parenthood clinics. So this is just a cynical move. It's just clearly aimed at Planned Parenthood, clearly aimed at abortion. Otherwise, why would you bring in all of that testimony and just hear, this session has really shaped up with a big theme for Republicans as being the war on abortion. And we've spent many, many committee hours hearing about that instead of many of the important needs of the state.
Anything? We gave you what you need. All right, thank you.